हेलो दोस्तों एंड वेलकम। आज हम बात करने वाले हैं एक ऐसी कॉमन फीलिंग की जिसे हम सब ने कभी ना कभी फील किया है, सांस का फूलना। वी आर गोइंग टू डिकोड व्हाट इट रियली मीन्स। यू नो दैट फीलिंग राइट? थोड़ी सी सीढ़ियां चढ़ी या बस के पीछे भागे और हांफने लगे, टोटली नॉर्मल। बट व्हाट इफ इट हैपन्स आउट ऑफ नोवेयर? जब आप आराम से बैठे हो तब इसका क्या मतलब है? व्हाट इज योर बॉडी ट्राइंग टू टेल यू देन? सो ये हमेशा बस एक टेम्पररी फीलिंग नहीं होती। It can actually be a really critical signal from your body. और इसको ठीक से समझने के लिए there's one key medical term we all need to know.
Alright, here it is. The word is dyspnea. Yeah, dyspnea. It sounds a little complicated, but all it really means is that personal feeling of breathing discomfort. Medical language में इसे subjective कहते हैं, जिसका सीधा सा मतलब है वो personal feeling, जो सिर्फ आप महसूस कर सकते हैं। जब आपको लगे कि सांस ठीक से नहीं आ रहे, that is dyspnea.
So let's get to the bottom of this universal signal. सोच के देखिए, आप डॉक्टर के पास जाते हैं इस कंप्लेंट के साथ। Where do they even begin their investigation? उनका starting point क्या होता है? This right here, it's basically a map of a doctor's mind. एक logical flow chart जिससे वो असली cause तक पहुंचते हैं. And the very first fork in the road, the most important question is this. ये problem अचानक शुरू हुई, मतलब acute है, या फिर ये काफी टाइम से चल रही है, यानी chronic.
Okay, so to really solve this mystery of dyspnea, we first have to understand how our lungs can struggle in the first place. Problem akhir hai kya? Broadly speaking, there are two main culprits behind most breathing problems. Think of them as the two main villains of our story, obstructive lung disease and restrictive lung disease. Now, I know the names sound a little technical, but trust me, the difference is super simple. Let's break it down. Okay. Here's the key difference. With obstructive disease, the problem is breathing out. Air comes in just fine, but it gets trapped and can't get out completely. Whereas with restrictive disease, the problem is breathing in. The lungs just can't expand fully. See? It's really that simple. Out versus in.
Let's make this even clearer with a simple analogy. For obstructive disease, just imagine trying to breathe out through a pinched straw. Feel that resistance? Kitni effort lagti hai, right? That's basically what it's like.
Now, for restrictive disease, picture trying to inflate a really stiff, tiny balloon. No matter how hard you blow, it just won't expand all the way. That's the struggle. All right, time to open up our first case file. Let's talk about obstructive conditions. The two most common examples you've probably heard of are asthma and COPD.
Now, here's where it gets a little tricky. दोनों में airway swelling होती है, दोनों में वो wheezing यानी सीधी जैसी आवाज आती है. So what's actually the difference? It's a super common point of confusion, so let's clear it up right now.
This table lays it out perfectly. Let's look at asthma first. ये typically younger लोगों में शुरू होता है. इसके triggers? Well, they can be things like allergens or even exercise. And the key thing is the symptoms come and go in attacks. Now, on the other hand, we have COPD. ये usually older patients में दिखा जाता है. And the primary cause is smoking. But here's the biggest difference. COPD is progressive. मतलब ये time के साथ unfortunately धीरे-धीरे बढ़ता ही जाता है. Okay, let's move on to our second case file, restrictive lung diseases. Remember, these are the conditions where the lungs just can't fully expand. और इसके पीछे, there can be a whole range of different causes. And to remember all these different causes, there's a really handy acronym, PAINT. So P is for plural, that's issues with the lung lining. A is for alveolar, like fluid in the air sacs. I stands for interstitial, which means scarring of the lung tissue itself. N is for neuromuscular, so weakness in the breathing muscles. And finally, T is for thoracic, which means problems with the chest wall. PAINT. Simple, right? And here's another important distinction. We can divide these paint causes into two groups. Some are intrinsic, meaning the problem is inside the lung itself, like that tissue scarring we mentioned. But others are extrinsic, meaning the problem is coming from the outside and affecting the lungs, like issues with the chest wall or weak muscles. Okay, so we've looked at problems with breathing out and breathing in, but there's a third culprit, a completely different kind of problem that can cause sudden breathlessness. And this one has nothing to do with airflow. It's all about blood flow. It's called a pulmonary embolism, or PE for short. So what is it? Well, it's when a blood clot that forms somewhere else in the body, usually in the legs, breaks off, travels through the bloodstream, and gets lodged in the arteries of the lungs. It's basically a roadblock in your lungs' blood supply. So how do doctors figure this out?
Well, the investigation starts with looking for clues. On a chest x-ray, they might see certain signs, like something called a Westermark sign or a Hampton's hump, that point towards a possible blockage. But, and this is important, these are just clues. They aren't definitive proof.
To get that definitive proof, they use what's called the gold standard test, a pulmonary angiogram. And as you can see here, this test allows doctors to directly see the clot. They inject a special dye, and the clot shows up as a filling defect inside the artery. There's no guesswork here. This is seeing the problem firsthand. So we've looked at 3 very different types of problems that can cause breathlessness. Now let's put it all together and understand the full picture. Let's go back to that diagnostic map from the beginning. It all starts with dyspnea, that feeling of breathlessness. That's the first clue. From there, the investigation branches out. Is it obstructive, like asthma or COPD? Is it restrictive with one of those paint causes? Or is it a vascular issue, a blockage like a pulmonary embolism? The whole thing really is like a medical detective story, starting with one symptom to find the real culprit. So, what are the key takeaways for all this? Let's do a quick recap. 4 simple points. 1. Dyspnea is just the medical term for shortness of breath. 2. Obstructive means trouble breathing out. 3. Restrictive means trouble breathing in. And 4. A pulmonary embolism is a blockage of blood flow in the lungs. That's it. Now, of course, the goal here isn't for you to self-diagnose. Not at all. The goal is to empower you with knowledge so you can ask the right questions and understand your body better. So the next time you feel that sensation, you'll have a better framework to think about it. And it leaves us with the final question. What is your body telling you?